Today we are demonstrating the use of the Alaris PC pump for fluids and IV medications. So before you see the pump, and this pump has two channels on it, channel to the left, channel to the right, and the main piece of the pump where you will program it. What you want to do is have your bag of fluids. Today we have normal saline. It is already spiked. The chamber is 2/3 full and the line is primed. You'll take your fluid or your medication, hang it up on the pump. You're going to put the pump on where it says system on. The pump boots up. It's going to ask you, is this a new patient? You're going to answer yes or no. We're going to say yes so we can demonstrate what that means. It's asking you, is this a medical surgical? You're saying yes. And you need to put in an identification number for your patient. This will be your patient's medical record or ID number found on their band. You put that in, and you're pressing confirm. The A and the B on the side indicate which channel you're going to be using for your fluid or medication. We're choosing channel A. And the three choices you see before you are the drug library, the IV fluid library, or basic infusion. We are only going to be selecting out of drugs or IV fluids. And this is because we don't want to program the pump without the settings already programmed into it. So today we are going to be running normal saline. So I'm going to check IV fluids. And you'll see that there's a library of fluids you can choose from. Right here we have normal saline, so I'm choosing that, and it's asking me, is this the correct fluid? I'm answering yes. Now we're at the point where you're going to program in the rate and the volume to be infused. So I'm checking rate, and I'm running this at 100 mLs an hour per the order. And then I'm moving on to volume to be infused, and I'm going to check 950. At that point, I can choose to delay the pump, and this will give me some time to set other things up in the room. I'm going to choose to delay it for 5 minutes. So you'll see that your pump is in standby. At this point, you can open the channel, which will start beeping at you. And one button you want to be aware of is the silence button. You're going to thread your tubing in. And shut the pump. You want to make sure your IV is connected and the roller clamp is open. And then you want to start the pump. And I'm pressing start. And your pump should be running. And I want to cancel the delay, which is right on the bottom. No. Cancel delay. Your pump will read that it's checking the line for air. And then you can start. If it says occluded, remember the silence button. Check your line. It'll pop out. And then you're going to hit restart.